Hello friends, let's see the pectoral region. This pectoral region includes the pectoralis major and pectoralis minor muscle mainly, along with the subclavius muscle, which is a very small muscle. But the MCQs concerned from this region are very important as far as the NEET or the next exam is concerned. So the superficial fascia within the pectoral region, it contains the breast. The breast is well developed in case of female, while in case of the male it is rudimentary. We are going to see the detailed anatomy of the breast in or the mammary gland in the upcoming lectures. When we see the deep fascia of the pectoral region, this deep fascia of the pectoral region, it is attached above with the clavicle, and it is going to enclose the pectoralis major muscle, and then it is again going to form the axillary fascia, which is the fascia which is situated within the axilla, and then this deep fascia, it is going to continue and resplit to enclose the latissimus dorsi muscle on the back. So now let's move on to the pectoralis major muscle. When we see the pectoralis major muscle here in this figure, we will try to draw the pectoralis major muscle. This pectoralis major muscle having mainly two head. One is the clavicular head and one is the sternocostal head. The clavicular head is going to arise from somewhere here. This is the outer surface of the medial half of the clavicle, and the sternocostal surface we are going to draw with the different color, and this sternocostal surface is going to arise from the outer surface of the manubrium as well as the sternum up to the sixth costal cartilage and the outer surface of the second to the sixth costal cartilage. Along with that, pectoralis major muscle also going to arise from the aponeurosis of the external oblique muscle, which is the muscle of the anterior abdominal wall. This clavicular and the sternocostal fibers of the pectoralis major muscle, they are going to converge and going to form a tendon around 5 centimeter in breadth, and this tendon is going to insert over the lateral lip of the humerus. But at the insertion site, the pectoralis major muscle fibers, they are going to twist with each other and going to insert over the lateral lip of the humerus in a U-shaped manner, where the clavicular fibers, they are inserted little lower, while the sternocostal fibers, they pass under the clavicular fibers and going to insert just higher over the lateral lip of the bicipital groove of the humerus. So these twisted fibers makes the anterior wall of the axilla, which is rounded. We can feel that anterior wall of the axilla which is rounded, and that is because of the spiral fibers of the pectoralis major muscle. When we see the action of this pectoralis major muscle, when these clavicular fibers get contract, it will lead to the flexion of the humerus. Along with that, the clavicular and the sternocostal, both the fibers, when get contract together, it will lead to the medial rotation of the shoulder joint as well as the adduction of the shoulder joint. So there are three actions of the pectoralis major muscle. One is the flexion, adduction, and medial rotation of the shoulder joint. So we can easily remember this action of the pectoralis major muscle by folding our arms, and this position shows the action of the pectoralis major muscle because it shows the flexion of the shoulder joint, medial rotation of the shoulder joint, as well as the adduction of the shoulder joint. So this position, the position of folding arm, it is the action of the pectoralis major muscle. This pectoralis major muscle, it is going to be supplied by two nerves. One is the medial pectoral nerve and the lateral pectoral nerve. The medial pectoral and the lateral pectoral nerve, they are the branches of the brachial plexus from the medial cord and the lateral cord respectively. This pectoralis major muscle can be asked as a short note. So many MCQs they can be asked also from the this topic of the pectoralis major. Like in case of the Poland syndrome, the pectoralis major muscle is absent. So it is a congenital disorder, that is the Poland syndrome, and within this congenital disorder, the pectoralis major muscle is usually absent. So this is all about the pectoralis major.